Tuelekee bungeni sasa, ambapo Gavana wa Mombasa Hassan Joho leo anahojiwa na kamati ya bunge kuhusu uhasibu, ama amehojiwa tayari na kamati ya bunge kuhusu uhasibu na uwekezaji, jinsi matumizi ya fedha yalivyotekelezwa katika serikali ya kaunti ya Mombasa. Hebu tusikilize jinsi mambo yalivyokuwa awali.
Coverage even from the hospitals, and I think
the numbers are rolling pretty fast. We want to appreciate.
No, you know you're going to use it.
Okay. Well, UHC, I think when we speak about UHC, everybody thinks it's just coverage of NHIF. It is actually how much population we are covering, how much of health services we are giving, and the coverage itself, how much financial burden we are reducing from the communities or the citizens. So what we are doing is, one is we have built 5 sub-county hospitals, and we are coming up with every sub-county to be self-sustainable. So there will be dispensaries, health centers, and a sub-county hospital, so that when you're in Likoni, everything that happens in Likoni, you can be treated there. Then if there's any referral, you'll be taken to this referral hospital. In fact, when we came into devolution, Likoni, any woman that delivers in Likoni had to take the ferry to go to Coast General Hospital for cesarean section. As we speak, we already have 2 theaters already in place, so no woman crosses the ferry to get a cesarean section right now. So we've already planned for our health services for anyone. So by the time we come for UHC, we have these structures ready. We've started on financial reduction of financial burden on the citizens. As we said, we're increasing our health insurance for the wananchi. As I said, we have 36%, but there's a very aggressive campaign. Patients, even within the hospital, we have NHIF clerks that we have employed to go around and look at patients. Lazima muwe na NHIF, so that so that anybody that comes in. But the final role is we really try to lobby that Mombasa should have been one of the pilot projects of the World Bank. But unfortunately, we were not taken, and we wish that Mombasa would have been taken for that. But we are looking at human resource, health services to cover the whole population, and financial costs.
Yes. Thank you. Maybe I can start with Senator Faki, then Professor Ongere.
Dr. One aspect which maybe you had not mentioned. Do you have a plan to maybe have a database? For instance, if a patient is attended to at Mrima Health Center, that information can be relayed to Coast General Hospital, so that in the event it requires a major or further investigation or treatment, that database is already there, so that you can be able to have a conclusive database of that patient, and the referral system could be much easier than what you have. The patient maybe just walks in with a book, tomorrow he has forgotten it, and there's no follow-up. Thank you.
Definitely, we are working.
Dr. it will be easier to respond to the consolidated queries. Professor, Senator, Professor, Dr. Ongere.
I have an immense interest in this field.
Yes.
Have you, for instance, attempted to make a definition between the curative and preventive and promotive healthcare services?
Yes.
Have you been able to categorize the MCH program across board in the coast in Mombasa County? Have you been able to look at the program of specialized services that you require, and where you will be able to concentrate your equipment to reduce the disease burden? That's the kind of graphics we like to see and hear, whether you've been able to cut across the health spectrum, so that the populations in Mombasa can feel comfortable that we now have a universal healthcare delivery system that reaches the people.
Senator Wamatangi?
The Chair, just wanted to also ask a last question there, especially on what has been presented by the CC, I believe the CC for Health. Because and it's appreciable that you said you've established five sub-county hospitals. It would be interesting to know what level of hospitals, but I think it's a commendable step that you've taken. But then what you would tell us, Governor, is this. You see, at the ordinary level of provision of medical health or medical health services, one of the big problems we are facing, Chair, is specialized treatment. And if you look at the number of people, for example, who are leaving this country to go to India for cancer treatment, to the United States for such treatments, I think the deal breaker, the milestone, will be with the counties that will start to specifically address those kind of things. Because, you know, from the onset when you came into government, for example, 2013 onwards, you've consistently addressed healthcare at what you'd call the general level. And so you have those dispensaries, you've got clinics, you've got the level 3, 4, 5 hospitals. But the counties chair that have specifically taken that bold move, and I hope, Governor, you could take that major leap and address this big problem that we have, especially, Chair, of the loss of foreign of resources of our people going to India, going to the United States for cancer treatments. Can you probably tell us what is it that you're doing for such specialized treatment as a county?
It's eliciting a lot of interest. Senator Olekina, make it brief.
Thank you, Chair. Governor, I just wanted to go back to this issue, which we're going to be discussing shortly with the Minister. And you mentioned that you have a problem with this MES contract. First of all, have you seen the agreement between the Ministry of Health and these contractors? That's question number one. And then question number two specifically is that since now most of you, Oparanya was here yesterday, and most of your colleagues are saying we have a problem. I'm looking at this MOU that was signed between you and the Ministry of Health. There is a dispute resolution clause. Have you sought to pursue that? And are you limited to the fact that you either don't have the contract or you have the contract between the Ministry of Health and these contractors?
So, Governor, you may respond, or your officer.
Okay, Senator Professor Dr. Ongeri, we have, as I was talking about the structures, community level, which is level 1, and level 2, which is the dispensaries. These will be providing the preventive and promotive healthcare, the packages. From level 3, level 4, and level 5 will be the curative. In fact, 2 of our doctors have gone for family physician, to do family physician. One is in Cuba and one is in Egypt right now. And we have already got our staff establishment to actually put clinical officers to be in charges of level 2 and the family physicians to be in charge of level 3. So that this way it can cover. So anything to do with preventive, so this is towards the universal health care. Thank you. On specialized care, we're actually doing a lot of subspecialties operations. One is open heart surgeries. This is the second year that we're doing. Then we have a new cancer chemotherapy center. And as His Excellency has said, we have partners who are ready to team with us to come up with a radiotherapy. We were invited to Austria just about 2 weeks ago on the same. We have plastic surgeons, we have neurosurgeons, and we have laparoscopic surgeons. So we do like the scope. We don't have our own cath lab, but we have an MOU with Aga Khan Hospital, Mombasa, which has a cath lab. So our intervention cardiologists are actually doing pacemakers and other stents from Aga Khan. But we already have a donor who is already, the conversation is actually very advanced, and we are soon, maybe in another 6 months or so, to get our own cath lab.
The specific question by Senator Faki, he was talking about linking the institutions, health information management system.
We actually use the 6 building blocks, and HMIS, Health Management Information System, is one very critical. And that is the one which actually led us to do the whole plan. So that is in plan. We haven't really done for the whole county. The hospitals are not talking to each other, but hospitals themselves, Coast General, Portrees, actually have systems already. But that is in the pipeline. Yes. Thank you.
Okay, Governor, you could respond if there was anything else that you wanted to cover. It might address any other lingering question that members might have.
Yeah, okay. She mentioned obviously on the integrated. We feel the need of also being able to keep track of our people, of the patients and the diseases that we've had to deal with, because it informs us on the next investment plan on what needs to be procured, for example. But to answer to this specific question on our people having to travel outside the country for treatment, Mr. Chairman, let me say this. It is not only equipment that is required. We also need specialized training. And that is why, as Mombasa County, as we sit here today, we have 42 of our doctors out there being trained or specializing on different areas of treatment. But the point that I want to say that as a county, we needed, or we want to continue to develop the infrastructure and the human resource capacity. And then the interesting conversation would check in on the kind of equipment that we would need. And therefore, I go back to my point, whereas the national government can not in any way be aware of our plans without consulting with us. It is impossible. And to avoid, like I said, which is a good thing, we have today probably the largest ICU facility outside Kenyatta Hospital. By default. We had our own plan. National government came without consulting us with their own plan, which is a good thing in a way, because we are offering that facility. But to avoid duplication and white elephant projects. For example, I know there are certain counties, I mean not, there are certain counties who we have had to refer their patients to Mombasa Hospital, and yet they have similar equipment that we do, simply because they don't have the human resource capacity to manage the equipment. That is why we have to have an integrated plan that covers human resource, infrastructure, equipment that is responsive to the current demand. So